Hey everyone, welcome to this week's Tuesday Talk at Home edition again. This is obviously during the COVID-19 outbreak and we are on stay-at-home order. So until further notice by Governor Murphy, we will be doing Tuesday Talks in my living room / kitchen. So I wanted to talk to you this week about implants. Many people inquire about implants and many people are unsure about what implants are, and so I kind of want to talk to you about what they are. Now, implants, you can have many different variations of implants. They can be mini implants, they can be larger implants, they can replace one tooth, they can replace multiple teeth, they can help hold dentures, they can basically be full mouth rehabilitation and restore every single tooth in the mouth. And so there's so many different companies, so many different manufacturers, and so many different ways to use implants. So I'm going to start off pretty simple. Basically, you have a tooth, your tooth is broken, it's one tooth, you need your tooth removed. Now you need to replace the tooth. So we have a couple options. We can do a removable denture, which most people don't like. We can do a fixed bridge, which is basically crowns on the teeth adjacent to the one that you just removed with a hanging tooth, and that's called a fixed bridge. Or you can do a single implant restoration. The single implant restoration is actually the best outcome because you're not affecting the teeth next to it, you're just replacing that one tooth. And so a single implant restoration includes the implant itself. An implant basically looks like a screw, and it gets screwed into your jawbone. I know it sounds painful, but it's not. You're numb. Just you feel a lot of vibration and some pressure. It gets screwed into the jawbone, and then there's an attachment that screws into the implant that also then holds a crown. And it can either be screwed in or it can be cemented in like a normal crown would be. So basically this is a single implant. So a single implant restoration is really, really good for replacing one tooth. Okay, it could be in the back, it could be towards the middle of your tooth, it could be your front tooth, and you can kind of replace that one tooth that you've broken. Now if you have multiple teeth that are missing, you can do an implant bridge. So an implant bridge are basically two implants that are anchoring and they're crowns on top, and then you have hanging crowns, kind of like how it would be if we did a fixed bridge where we didn't use implants, we used your actual teeth. So a implant bridge is really good if you're trying to replace a bunch of teeth in a quadrant. So let's say, for example, you've lost 3 or 4 teeth on the bottom left. You can actually replace those 3 to 4 teeth with 2 implants and then hanging teeth that attach it. And now you have your entire left quadrant back to function, which is really important. So those are different ways to replace 1 to a few teeth. Now let's say you have a denture. You have full dentures up and on the top and on the bottom, and you're so unhappy with them because they move around, they're uncomfortable. What you can do, you have a couple different options, but you can place a couple implants on the bottom and a couple implants on the top, and you can actually have the implants be the anchor for those dentures. So it basically can clip in, and these are called implant over dentures. They clip in and you can remove them and clean them, but they're anchored. There's something that's holding them in, so they're not gonna move around on you when you're chewing or move around when you're talking. And this is a very cost-effective way to have your dentures fit really well without having an insane amount of surgery and an insane amount of cost associated. Because if you do have dentures already, they can actually be basically refabricated to work for the implant. So you don't have to get a whole new set of dentures, which actually really is cost effective. Now the other option, if you don't have a lot of bone, which a lot of times people that have dentures, as we get older, you lose bone. If you don't have bone, there is another option, and these are called all-on-4s or all-on-6s. And these are basically a much more surgical approach to creating a full mouth rehabilitation, where the dentures, you basically create a denture, but it does not get removed. And you have these long implants that get placed into the bone, either 4 implants or 6 implants. That's why it's called all-on-4 or all-on-6, and that's determined based upon the patient. But those implants get placed really deep into the bone, and the denture actually gets, you know, screwed in, and it stays in place. It does not get removed. And this is a incredibly good way to have sustained function and sustained teeth and, you know, aesthetics without removing anything. And it's very, very good in terms of function. So, but its drawback is it can be extremely expensive, and everybody's different on how much the cost is, but you know, it can be pretty pricey per arch. And there's a lot of planning that goes into an all-on-4 or an all-on-6 case. So those are the different types of options for implants. Now, implants are really, really beneficial, especially, you know, in this day and age. Implants are so much better because you're not affecting teeth next to it. If you have teeth that are perfect and you don't have issues with them, you don't want to drill down those teeth and, you know, basically make them weaker because you want to replace a tooth that you have missing. So the implant, it really gives sustainability. It's 99% effective, and it's just an incredible way to replace missing teeth. So there's limiting factors such as medical history, so patients that are smokers, patients that have diabetes, patients that have low bone density. Those are going to be more difficult cases for implants to stick and to actually solidify into the bone. But the biggest way to know is actually to consult the oral surgeon or to consult your doctor and see, you know, what your chances are of having your implants be successfully integrated into your bone. So just because you have those does not mean that you are not a candidate. It just means that it could, you know, might take a little bit longer to integrate, or there might be other steps that we have to take before we can actually go forward with the implant process. So if you have any questions, please leave a comment below. I hope that this helped. I'm going to put some videos within, you know, this Tuesday talk to kind of show you different implants and systems and how it works so that you kind of understand what it is. And yeah, again, if you have any questions, leave a comment below, and thank you for watching. We'll see you next week.